CNA post-meal positioning aspiration. Welcome to the quiz. Question 1. You are sitting in a team meeting when the nurse manager is discussing the importance of clear communication among healthcare team members. She is explaining why communication is so important and what constitutes effective communication. Based on understanding the key elements of effective communication in healthcare, which statement best describes what is most important in healthcare communication? Option A. Speaking frequently and using many words is most important to ensure you are communicating effectively. Option B. Using complicated medical terminology and jargon is important so that you sound professional and knowledgeable. Option C. Ensuring that your message is clearly understood and verified through feedback is most important to ensure safe and effective communication. Option D. Whispering softly to other staff members in order to protect patient privacy is the most important aspect of communication. The answer is C. Effective communication requires that the message is understood and verified, closed-loop communication. Option C is correct. Quantity of words, jargon, or whispering do not ensure understanding. Question 2. You are assisting Mrs. Gloria Thompson, a 78-year-old female patient, with her care when she asks you to help her take her prescribed medications by mouth. However, administering medications is beyond the scope of practice for certified nursing assistants and is the responsibility of licensed nurses. She is requesting something that is outside your scope of practice. Based on appropriate professional boundaries and scope of practice for CNAs, how should you respond to this request? Option A. Help her take her medications anyway to keep the patient happy and satisfied with your care. Option B. Tell her that you cannot help her with medications and ask her to do it herself without explaining why. Option C. Refer her request to the nurse, explaining that medication administration is performed by the nursing staff. Option D. Tell her that you cannot help with medications and suggest that she wait until she sees a doctor before taking them. The answer is C. CNAs cannot administer medications. The request must be referred to the nurse. Option C is correct. Option A is outside scope and unsafe. Option B dismisses the patient without guidance. Option D is incorrect. The nurse can administer the medication now. Question 3. You are learning about the major risk factors for pressure ulcer development and understanding which patients are most vulnerable. Your facility is emphasizing pressure ulcer prevention as part of quality improvement initiatives. Based on understanding of pressure ulcer risk factors, which single factor most significantly increases a patient's risk for developing pressure ulcers? Option A, being very tall or having large body size. Option B, immobility and prolonged pressure on specific body areas without frequent position changes, combined with poor nutrition and incontinence. Option C, having a large appetite or eating more food than other patients. Option D, receiving frequent visits from family members and friends throughout the day. The answer is B. Immobility is the primary risk factor for pressure ulcers. Option B correctly identifies immobility, pressure, poor nutrition, and incontinence. Options A, C, and D are not significant risk factors. Question 4. You are assisting Mr. Frederick Wilson, an 82-year-old male patient with very limited mobility due to multiple health conditions, with toileting needs. He is not able to walk to the bathroom, but he is medically stable and his physician has recommended that he ambulate or be assisted to move as much as possible to maintain strength and circulation. You need to decide how best to help him use the bathroom. Based on promoting patient mobility, independence, and proper elimination care, how should a patient with limited mobility be assisted to use the bathroom? Option A. Use a bedpan in bed every time to minimize the patient's need to move, since moving him might cause injury. Option B. Encourage and assist him to ambulate to the bathroom with appropriate assistance and safety measures, if medically appropriate. Option C. Restrict his fluid intake to reduce the number of times he needs to use the bathroom. Option D. Keep him on bed rest continuously and do not allow him to get out of bed for any reason. The answer is B. When medically appropriate, assisting the patient to the bathroom promotes mobility and dignity. Option B is correct. Option A, bedpan use should be minimized if patient can ambulate. Option C, fluid restriction is inappropriate. Option D, unnecessary bed rest worsens deconditioning. Question 5. You're observing Mrs. Beverly Harrison, a 68-year-old female patient on a diabetic diet. You notice that one of her family members has brought her a large slice of chocolate cake and is encouraging her to eat it. The patient is eating the cake despite the fact that it is not part of her prescribed diet and could affect her blood sugar control. You understand the importance of dietary restrictions in managing her diabetes. When you observe a patient consuming something that is not on their diet, what should you do? Option A, say nothing about the incident if the patient asks you not to tell, even though the dietary violation could affect the patient's health. Option B, report the observation to the nurse immediately so that the situation can be addressed and appropriate education can be provided. Option C, take the food away immediately without explanation and throw it in the trash. Option D, only document the observation in the chart without reporting it to anyone else. The answer is B. Dietary violations must be reported to the nurse so the patient can be educated and blood sugar monitored. Option B is correct. Option A is dangerous. Option C is confrontational and may damage trust. Option D, documentation alone is insufficient. Reporting is key. Question 6. You're assigned to provide catheter care for Mrs. Christine Foster, a 75-year-old female patient who has an indwelling urinary catheter. You understand the importance of proper catheter care in preventing infection and ensuring the catheter remains functional. You are performing catheter care as instructed by the nurse. Based on proper technique for providing catheter care, which is the correct procedure? Option A, use the same washcloth for all patients to save time and supplies. Option B, clean from the catheter insertion site outward along the catheter using a fresh section of cloth with each downward stroke to prevent pulling bacteria into the urethra. Option C, clean from the patient's body outward and then back toward the catheter insertion site, since this direction is easier. Option D, only clean the tubing of the catheter without cleaning around the insertion site. The answer is B. Catheter care requires cleaning from the meatus outward, using a clean section for each stroke to avoid introducing bacteria. Option B is correct. Option A, cross-contamination. Option C, cleaning toward the insertion site pushes bacteria toward urethra. Option D, the insertion site must be cleaned. Great job! Don't forget to subscribe. Bye!